And Kelly, you can take it away.
All right, thank you very much, Christina. Thank you everybody for joining us today. I am Kelly Dubler. I'm the Director of the Bureau of Health Promotion and Risk Reduction here at the Department of Health. For those of you who aren't familiar with our bureau includes programs for tobacco prevention and control, cancer prevention and control, nutrition and physical activity, and violence prevention. Here at the department, we aim to provide education and services to those impacted most by smoking-related diseases, chronic diseases, mental health issues, and low access to health services and prevention. Across all of our programs, the goal is health equity and reducing diseases caused by chronic illness, improving the environments where we live, work, and play, and reducing the impact that tobacco use has on the population. Today is the second session of the 2023 Pennsylvania LGBTQIA Virtual Health Summit, which is being presented as a series of 4 live streamed events and 1 in-person event in June. So the June event is actually a hybrid event. You can go in person or attend virtually. I really hope you'll join us for the next 2 events in the series. The topics will be mental health on May 12th, looking at the unique mental health strengths and challenges present in the LGBT community. And then in June, we will look at community efforts to push back against tobacco industry targeting of the community in the session titled Taking Pride in Tobacco Cessation. You can register for the future events at Bradbury-Sullivan.org, and I believe they are dropping in the chat the link to register for those events. The department is very happy to support Bradbury-Sullivan LGBT Center in hosting this important series, which builds on the success of previous LGBTQ health conferences that were held across the state from 2017 to 2021. Today, we will look at culturally responsive health education and how health promotion campaigns can effectively support the LGBTQ+ community. Findings related to health disparities, healthcare discrimination, and recommendations for welcoming and affirming practices will be shared. According to the 2023 Health Needs Assessment, about 1 in 4 Pennsylvanians have not disclosed their LGBTQ identity to any of their healthcare providers. This is true for 38% of Hispanic respondents, 29% of respondents under 25 years of age, 41% of respondents of color, and 61% of Asian respondents. Additionally, about 1 in 3 respondents had a negative reaction from a healthcare provider when sharing their LGBTQ identity. This was true for 40% of respondents of color, 45% of Hispanic respondents, and 45% of transgender and non-binary respondents, and half of Asian respondents. For LGBTQ Pennsylvanians, past or potential negative reactions from healthcare providers sometimes, often, or always prevent them from seeking care. So as you can imagine, this data is very alarming, and it's also vital to understanding where there are gaps in services and ways that we can all work as a community to better serve the LGBTQ population. And now I will say I am thrilled to get to introduce today's keynote speaker, George Fernandez. George is the president and CEO of Color and Culture, an integrated family of brands and changemakers that provide culturally relevant, human-centered strategies to solve ever-evolving challenges. As the brainpower and visionary of Color and Culture, George is focused on helping organizations transform lives and communities by embracing all cultural identities. And on a side note, I will say I got the opportunity to attend the Latino Health Summit last week that George's organization, Latino Health, that they put on, and the summit was amazing. I was so excited to get to be there. If you weren't there next year, be sure you get there. George, you're welcome for the plug, and I'll turn it over to you.
Thank you so much, Kelly. I'll cash out you $20 for the shout out there. I'm so humbled to join an amazing group of change makers that are making a really big difference in the LGBTQ and Hispanic space in Pennsylvania. For those of you I haven't had the pleasure to meet, I'm George Fernandez. I'm the founder and CEO of Color and Culture. Next slide. Most recently, Latino Connection merged with PPONS. PPONS has been in the marketplace for roughly around 40 years, doing integrated marketing communications. And together, Latino Connection, which is my full-time gig that I started in 2015, merged with PPONS to create Color and Culture. Next slide. Color and Culture is a social determinants of health marketing communications agency specializing in public health programs with a mission to educate and uplift underserved communities. I am a product of a single mother of 3, survivor of domestic violence. I myself have lived and breathed a lot of the challenges that our communities today really experience. And I've taken firsthand my challenges as a young kid, as a very young adult, and have made that the purpose and the backbone of why we do what we do today. And this type of work that we do would not be possible without amazing partners like Bradbury-Sullivan, and even great funders and organizations like Kelly and her multiple bureaus that we work with here at Latino Connection, now a Color and Culture catalyst. So what is social determinants of health? Some of us might know what it is. So in the next slide, I have a small activity and a challenge. And you got a little preview a few seconds ago when they were bringing up my slides. So thanks, Christina, for giving people a little head start. But I wanted to maybe just take 1 to 3 minutes and give everybody the opportunity to find one or 2 or 3 keywords that are in here in this beautiful puzzle piece. What are some examples of social determinants of health? Christina, is there a way that people can drop words they find into the chat box? Do we have a chat box feature here? Okay, so I encourage everyone to just
feel free to use the chat.
Yeah, feel free to drop some. I will start to cross them off as I see. Let me see. Where's the chat box for me? All right, there I am. All right, so in the chat box, drop whichever words you're seeing that relate to social determinants of health. Go Kelly, first one, gender identity.
It looks like some folks are having trouble using the chat. Natalie, can you check on that? Thank you.
When we think about social determinants of health, let me speak for myself. When I think of social determinants of health, I think of it as like the foundation of being able to live a successful, engaged, active lifestyle. And the challenges that go along with social determinants of health can be so many, right? Whether it's financial wellness, whether it's access to care, whether it's education. I mean, even your zip code can help determine, the health conditions that someone could develop in their community. Social justice, right? The Black movement that we've been seeing with our Black brothers and sisters, and even our Asian brothers and sisters. I see transportation coming up. I see housing. Those are all great examples. Parental education, gender identity. I see that again. Thanks, Monica and Kelly. I see wealth. These are all great examples of social determinants of health. There are a few others before I go on that I want to make sure that we bring to light here. When I think about myself, being that young Hispanic kid, language access was really big. I remember having to be the interpreter for my mother, and address with her what were her health conditions, and that's something that perhaps a 12-year-old kid should never, be responsible for, having to interpret. Someone said language. There's another word right after language in this puzzle. It's language skills. So very, very close there, Kevin, almost. Transportation already came up. Wonderful. I want to bring up 2 more. Keep looking, they're out there. I also think about, most recently I started doing housing and I'll talk about housing and affordable housing and talk about, the stigma that goes around with affordable housing vouchers and Section 8 and what that looks like. So housing plays a very key role and the type of work that we do, but also food access. Food access is also here. There's one more. Anybody else want to take a try with one or two more that are still in this puzzle? Ask now, forever hold your peace. Christina, you can go to the next slide. Wonderful. Here are the answers, everyone. Sexual orientation, parental education, healthcare access, language skills, gender identity, food access, skin color, employment, housing, wealth, transportation, and drug use. While these are not all, these are just a few examples that really hit home for me when it comes to talking about social determinants of health. For those of you that have met me before, you may have heard me say this plenty of times. I'm a big believer in having the uncomfortable conversations that we need to have in order to help our communities progress. And I'll say it again. I think it's extremely vital that we have the uncomfortable conversations that can help our communities progress. It's very uncomfortable to talk about the color of someone's skin and how that affects social determinants of health, whether it's access to their financial wellness, whether it's access to better housing, whether it's access to healthcare access, whether it's access to even better housing or even transportation. We're living in a time that it's just no longer cool to be having these conversations. So me personally, I'm a big fan of having the uncomfortable conversations that can ultimately help our communities progress. Next slide. Next slide. Latino Connection has been around since 2015. I started this agency with $250, a broken ass laptop, and a borrowed credit card from a girlfriend. That is the God to honest truth. And today we are 52 full-time associates on this team. And I call them change makers and I call them healthcare warriors. The type of initiatives and events and programming that we offer are very hands-on, very educational, and are leave a lasting impression that can ultimately help to create a behavior change in the individuals that we are essentially reaching. So my presentation today will be a little bit more of storytelling of what are some of the initiatives that we have here at Latino Connection and PPOS and now Color and Culture, and the types of partnerships that we're able to bring to light, not only with Kelly and her amazing team at the Pennsylvania Department of Health, but also the 130 plus corporate organizations that we get to work with and represent in multiple states across the country. Most recently, as Kelly talked about, this past weekend, actually, we hosted our Adelante. Adelante means to move forward. Our Adelante Health and Wellness Expo, most recently held in the city of Reading. Our keynote speaker this past weekend was Lori Fernandez, two-time gold medalist, Olympic award winner from 2016 Olympics, the youngest Team USA player. Also self-identifies as a lesbian, so a part of our LGBTQIA community, and she's a Latina, but doesn't speak very much Spanish. So talk about language access and being able to have someone like her be on the main stage of a statewide Latino Health Summit event, which was most recently televised by PCN. We do career fairs, we do health and wellness expo roadshows and reaching seniors. Talking about seniors, it's so vital that we reach our senior community, predominantly in the LGBTQIA community. There's a lot of lack of access and resources for seniors, let alone LGBT seniors, much even more. So these are some of the economic stability type of initiatives and events and programming that we offer here at Latino Connection through Color and Culture, and really talking about money and financial wellness. Next slide. In the area of education, I believe that education is the power, is the power to unlocking knowledge, and knowledge is the key to success in my personal opinion. So here at Latino Connection, we're very, I can say purposeful and very driven to make sure that we have partnerships that hire interns. And not only do they bring the book smarts, but we also want to teach them the street smarts, right? Of getting out and about and networking and building relationships that are authentic, that can ultimately help to create those drivers to be more active and more engaged in the community. So we partner with local colleges and universities such as Harrisburg University, Millersville, Penn State, Dickinson College, and we create internship opportunities that really put those young college students into places that they typically would not be placed into. So we go into low-income communities. Sometimes these are communities where, I've been to elementary schools where there's a condom, on the playground. I've been to affordable housing communities where there are, open drug syringes right on the floor, right? So those are, again, uncomfortable spaces to be in, but that is the reality of our communities. And therefore, by us placing interns into those communities where they travel with us, they're with us, we go to communities where we feel safe, where we know that these organizations and these individuals just need a little bit of authentic love. And we're able to create partnerships that are authentic, that are responsible, but that are ultimately driving change in behaviors and connecting people to resources that can empower them to live healthier, more active, engaged lifestyles. We also engage with partnerships in schools, whether it's at the elementary level, whether it's at the high school level, or even the college level, with certified translation and interpretation services. Translation services, what we do here, we do it really well because we have a phenomenal group of people that are just very passionate about linguistics. You'd be very surprised how many times we argue over an accent, over an I or over an O. I never win, by the way. I never win any translation fight here at the office. The team doesn't let me win very often, but we take a lot of pride in the type of work that we do around education. Two of our biggest success stories, which you'll get to see pictures here in a little bit. During COVID, we partnered with the Pennsylvania Department of Health to launch a mobile COVID-19 mobile response unit, which you'll learn about here in just a little bit. But at Latino Connection here, we have a fleet of mobile vehicles. And in 2018, we started with one, and today we are at 17 vehicles. So it's a big leap of growth from 2018 to where we are today. And managing 17 mobile wellness units, mobile vehicles, essentially, that we partner with community, business, healthcare, education, and government entities. And we try to build strategic solutions that are more purposeful and more action-driven in reaching the communities that are essentially and ultimately really hard to reach. The power of storytelling, which I mentioned earlier today, and you may have seen this, Kelly, and a few others that are on this call that attended the Latino Health Summit. We have an immersive storytelling experience called Meet the Garcias, where you walk into this immersive experience and you learn about the challenging stories of Hispanic households, whether it's my story or whether it's someone else that's on this call, and the barriers they've had to overcome to allow them to be better Pennsylvanians, whether it's transportation, whether it's language. And we walk them through the living room of an abuela, of a grandmother, of a Hispanic grandmother, where at times being gay and being lesbian isn't a conversation that you can have over the kitchen table, and let alone all the challenges that go along with that and not being able to be yourself with your family. So we really believe in the power of storytelling, and a lot of what we do in the education side of Latino Connection is we want to build those immersive storytelling opportunities, such as Meet the Garcias. Next slide. Social and community context. I mean, when you think about what is human-centered research, human-centered is really putting at the core of everything that you do the needs of those constituents that you're essentially and ultimately looking to reach. A colleague of mine by the name of Jorian has his degree in human-centered innovation and design. And back in November, I had said, let's go out and buy some turkeys and deliver some turkeys to communities. And he said, George, why do you automatically assume that the people that we're going to go out and give these turkeys to have a working oven, or let alone even have the other ingredients that are needed to make an oven, that are needed to make a turkey? And it kind of took me by surprise that, I'm even in this space of social determinants of health each and every single day. And I too am still learning. So it's challenging the status quo and challenging, that we too need to learn something each and every single day. So putting at the core center of everything that we do and making sure that we are inviting individuals to the table to have a conversation and to identify what are their needs. Because I ultimately believe that I know what Christina needs, or I know what, Owen needs, or anybody else on this call, but that's not the case. We need to make sure that we are being inclusive and that we are being purposeful in making sure that those individuals who are at times voiceless actually have a voice in the type of outreach and in the type of engagement in the way that we reach them. So we take a lot of pride in our research focus groups that we do here at Latino Connection, really bringing to the forefront the uncomfortable conversations that can help our communities progress. I really enjoy the way that we do our focus groups here. Our focus groups are very non-traditional. We bring music, we bring a DJ into them, we bring food, sometimes a little too loud, which doesn't help the recording. But it's like a family gathering of individuals coming together to feel safe and to be in a space where anything and everything said is okay to be said. Questions that are asked are sometimes uncomfortable, but again, having those uncomfortable conversations is really what needs to happen. And we really attribute a lot of our success that we do around focus groups and listening sessions and town halls. We really attribute that to our bilingual community health workers here at Latino Connection. We started with one bilingual community health worker in 2018. And over the past few years, we've grown that to roughly around 12 to 13 bilingual community health workers. One of the questions that I get very often about our community health workers is, how come we have very little turnover rate with our community health workers? Your average community health worker isn't bilingual. So when we find our hands on someone that is bilingual and that we get them trained and certified to become bilingual community health workers, they are extremely well compensated. We go above and beyond in making sure that those community health workers have the tools and resources, but that we too are walking our talk and providing a salary that is not just a livable wage, for a bilingual community health worker, and making sure that they understand that they are our front line of defense in the type of work that we are doing to keep our communities healthy, active, and engaged. So in the social and community context of our initiatives and our events and programming, we're just very proud of what we do with our research focus groups, as well as our bilingual community health workers. Next slide. A lot of what we do here at Latino Connection, I would say more than 50% of what we do really falls into the area of health and healthcare. If we don't have our health, then why worry about anything else, right? That's what I've been saying since I started this agency. So we take a lot of pride in being a catalyst and bringing to the forefront great conversations, whether it's creating conversations and creating synergies and collaborations in both public and private sectors, both corporate and community and so forth. So in 2018, we launched the Pennsylvania Statewide Latino Health Summit, phenomenal event in Lancaster. We then went on to 2019 to host it in the city of York, phenomenal event. And then of course, COVID happened. So we took a pretty nice hiatus to keep our community safe. And we're just really thrilled that we were able to bring it back in 2023. Again, our bilingual community health workers, we host an annual event called the Communities Against the Opioid Epidemic Symposium, really bringing to the forefront a lot of the discussion around opioid abuse and substance abuse, and bringing inspirational speakers that can tell their stories. I mean, we're out here finding speakers that have recently been released from jail and can come and talk about their reentry experience and their experience that can be essentially inspiration, but also aspiring to making sure that we are creating opportunities for people that typically would not be considered for those types of opportunities. In partnership with Kelly and her bureau at the Pennsylvania Department of Health, we run a program through the CDC called Wise Woman. Here at Latino Connection, we call it Powerful Woman. And it's a series of programming that we partner around cardiovascular disease and really bringing to the forefront finding Hispanic women and African-American women that are at risk of cardiovascular disease, such as diabetes and obesity. Our healthy pop-up events, and even our Health and Wellness Roadshow for seniors. Next slide. We really focus a lot on building great environments and neighborhoods. And we do this essentially through our mobile wellness units, which you'll see a few pictures of here shortly, our community health workers, but also our tobacco sales enforcement and our merchant education. When you think about all the little bodegas and the corner stores that exist in the communities, upward of about 60% of ownership within those bodegas and corner stores are owned by Hispanic business entrepreneurs. And if you don't know the rules, how can you follow them? So I'm going to go into my next part of the presentation here, where I really talk a lot about tobacco and LGBTQIA and the work that Latino Connection is doing around making sure that we can help get our message across to those merchants, but also essentially the community at large. Next slide. So to get our messages and education across the various audiences, we implement unconventional and innovative ways to meet people where they work, live, and play. Sometimes I even add pray in there because mom knows if I'm not praying, I'm in trouble. Latino Connection is equipped to implement educational programs at risk communities to increase health literacy, which essentially results in better health outcomes and also increased healthcare engagement. Next slide. Next slide. While you might know a lot of these facts already, I just thought it was a great refresh, and I'm really appreciative of Dr. Sean McCormick on my team, and Nelson and Jordan that helped me to put this presentation together for today and really talk about the tobacco use amongst LGBTQIA+ community. While I won't cover all of these points, I just want to kind of highlight a few of the ones that are most astonishing for me. So overall, more lesbian and gay bisexual individuals use tobacco, 25% use tobacco, more than heterosexual adults at 19% that use tobacco. 36% of LGBT smokers use menthol compared to 29% of heterosexual straight smokers. Menthol users have a more difficult time quitting. I remember when my mom smoked for approximately about 25 years. It wasn't until I was in high school where her lungs collapsed and we almost lost my mother. And at her bedside, by her bedside, she promised that day that she would quit smoking. And that's exactly how she did it, cold turkey. She only needed one shocking experience to essentially help create that behavior change for her kids. Pretty cool. Next slide. Gay men can have high rates of HPV infection, which can couple with tobacco use, increases their risk for anal and other cancers. In Pennsylvania, the current smoking rate of LGBTQ+ adults is 1.7 times higher than the heterosexual adults. Next slide. Factors related to tobacco use and health outcomes. Gays have higher rates of PTSD, depression, and anxiety. The anxiety felt over coming out to conservative religious family, that really identifies with me because I remember what I had to go through in order for me to come out to my mom. Those are days I don't want to recall. LGBTQ+ individuals have deeper struggles with quitting. LGBT individuals are 5 times less likely than others to call a smoking cessation quit line. Gay, bisexual, and transgender men are 20% less likely than straight men to be aware of smoking quit lines, despite having exposure to tobacco cessation advertising. Next slide. The LGBT community is heavily targeted by the tobacco industry that sponsor events, bar promotions, giveaways, and advertisements. I'm really excited that in the next few slides, Nelson kind of helps me take it back to some really old advertising. But it's great to remember where advertising comes from. LGBTQ+ individuals are less likely to have health insurance than straight individuals, and lack of health insurance may negatively affect access to cessation treatments. Next slide. Targeting. Well, I love Target, and I believe that I'm a personal target of Amazon advertising through my smartphone. One of the biggest targets in smoking is the LGBTQ+ community, and you'll get to see some of those ads here. But the LGBTQ+ heavily target tobacco industry. Predatory marketing practices have been in place towards people who identify as LGBTQ+ for decades. In '95, tobacco company R.J. Reynolds created a marketing strategy called Project Scum, subculture urban marketing, that aggressively targeted alternative lifestyle individuals, such as gay men and homeless, to purchase their products. Next slide. How cool are these ads? In my mind, they're really cool because they create the inspiration of why we do what we do today. And this is the type of marketing that was used in the late 1990s to target not only gay men, but also other types of communities, essentially, that were considered alternative lifestyle. Whether it's a Get Lucky ad with 2 super handsome men, or the guy without his t-shirt, or the sailors. That is the type of marketing that's been going on for quite some time, and really excited to see what that essentially has been evolving to over the last few years. Next slide. Other great samples. I mean, this gives me like Abercrombie and Fitch vibes, from the early 2000s when I was in high school, right? The guy without the shirt, Light My Lucky, Salem Refreshes Naturally, Kent Golden Lights, Virginia Slims. These are the types of advertising that really resonate with our community, and because they feel like they can see themselves in the ad, they are more likely to purchase the product. Next slide. And these are perfect examples of what that advertising is changing to today. So while some of you already know and have seen this, tobacco companies have made major investments in advertising and gay press publication and have used corporate philanthropy as evidence that it supports the LGBT community. And that's the way they do it, by identifying like us and by bringing to the forefront topics and areas of comfort that we feel comfortable, that we can self-identify with it. Next slide. So how do we improve that outreach, which is really the main focus of my presentation? And that was my first alarm to check in on time, Christina. So Dominicans could talk all day. So I need you to kind of wave me down and, tell me where I'm going here. But improving LGBTQ+ community outreach for prevention and cessation. We take a lot of pride in the way that we reach our communities here. We do that very authentically. So we, over the past few years, we've put out some amazing customized messaging to help the LGBTQ+ people from quitting smoking. I didn't bring some of those samples today because I feel like there's so many people on this call that have perhaps seen me present before. So I really wanted to focus on the past and the history and talk a little bit of our success versus just always bringing you the amazing, great images of the work that we do that we were recognized nationally for. We also talk about addressing and recognizing the increased worry and pressure that our community faces. I think that we don't talk about that pressure and what our community faces, and by having those conversations, I think that we can just be a little bit more authentic and more original in the way that we are essentially reaching the communities that we need to be reaching. We also play a vital role in making sure that we are connecting and educating professionals, whether it's our healthcare providers and doctors, about their LGBT patient-specific needs. So we work a lot with major hospital systems, whether it's the UPMCs or the Penn States or the WellSpans of the world in this region, and even UPenn out of Philadelphia, or even Allegheny Health Network out of Pittsburgh. Those are all great organizations that we currently have existing relationships with. We are constantly a conduit in having the uncomfortable conversations that can help those research doctors and those providers understand how they can be better providers for the communities that they're essentially looking to reach. Next slide. Increasing access. Remove the barriers to those evidence-based treatments. For quite some time, we've always understood and have learned what those barriers are. Enough is enough. Remove the freaking barriers already. Meet them where they are. Go where they are. Pay them for their time. Listen, but not only listen, then just store the data on the shelf. Implement the data. Same thing that Jorian said to me back in November. No, we're not just buying the turkeys. We're going to go out and find out what people need for this holiday, for this Thanksgiving, and we're going to give them what they need. So by listening and implementing what people need, you are essentially increasing access. Whether it's also increasing insurance coverage for treatment. This is a great conversation that needs to continue to happen, and increasing that access and also increasing the coverage for treatment. Places. Engage community to adopt clean indoor air policies, including bars and restaurants. I have chronic asthma, and I love going into gay bars and just having a great night with friends and family and neighbors and whatnot. But it's very rare that you gay bar that is LGBT smoke free. So I think that those conversations need to continue. And ultimately, how can we inspire our entire community to live healthier, more active, into having that conversation? I love that my husband, Nelson, before people come over to the house, our friends that are smokers, he says, you can't even smoke outside. It's like our house is completely smoke free. No smoke, no smoke. And these are the types of conversations that I too would encourage you to have with your friends, family, and neighbors that can ultimately also help protect us from exposure, whether it's exposure at public events or even the festivals that we are sponsoring at the community at large. Christina, let me know how I'm doing on time. Next slide. Build
We've got about 5 to 10 more minutes if that works for you.
Wonderful. That works for me. I can talk really fast and then I have some great pictures to kind of go through. Yep, I'm good on time. Building awareness. Build awareness and expose the tobacco industry marketing targeting LGBTQ+. That's so important, and making sure that you are hosting that conversation, whether it's with young people in your family or the young groups that we all volunteer with that we're very heavily involved in. Also influence public policy. Stand up and have the uncomfortable conversations with your legislators and your state reps. Reduce the density of tobacco retailers in the product placement. Implement prevention and cessation messaging at the point of sale. And also prohibit flavored tobacco products. Next slide. This is perhaps one of my favorite ones. Increase direct funding to LGBTQ+ organizations. It's so important that we fund the organizations that are ultimately reaching the individuals that we need to be reaching. Constantly in healthcare, the funds go to a bigger box agency that then has to subcontract someone that has a specialty in reaching those communities. Enough is enough. Fund the people that mirror and that look alike, like the constituents that you are looking to reach. And at times I hear, well, they don't have the certifications or they don't have the knowledge. That was me when I started this agency in 2015. And in 2016 is when Health Promotion Council and PHMC gave us the first opportunity to get into this space. And no one else would have funded us for something like this. So, a big shout out to my friends from PHMC that might be in this call and Health Promotion Council. Thank you so much for believing in us and for connecting us and giving us the technical assistance and the education that we needed to be able to reach the Hispanic and the LGBT communities that you knew you wanted us to reach. So thank you so much. Sponsored tobacco-free pride events, direct sponsorship rather than sub-grants for tobacco cessation. And ultimately, what I love the most that my team says, show some love and compassion. Love and compassion. It goes a long way. Next slide. Next slide. Some of the other work that we do here at Latino Connection with our community health workers is called the Live Your Best Life. It's a DSMES diabetes prevention programming. I can't tell you the number of individuals that are smokers, that are LGBT, that are also pre-diabetic or diabetic. So that's why I wanted to build this into today's presentation. Next slide. Our entire team here is certified through the Community Health Workers Program at Temple University. We were Temple University's first community health worker program in 2019, right before the pandemic started. And we launched this program directly here at Latino Connection with health risk assessments and so much more of what we're able to do. And we connect people to resources in order for us to be able to do this through funding made possible at the Pennsylvania Department of Health. Next slide. A lot of the content that the program really does is evidence-based. So really bringing to the forefront that CDC evidence-based programming, whether it's class number 4, eat well to prevent type 2, or know your health, your heart healthy, cope with triggers, finding time for fitness, manage stress, stay motivated, eat well while away from home. That is so hard. I used to be able to eat an entire large pizza. I miss those days. So this is some of the great content that our team puts out into communities in order to inspire people to live healthier, more active, engaged lifestyles. Next slide. We're finally getting to the good part here, the good pictures. Here are a few pictures of our mobile units where we meet people where they are. We go to housing authorities, we go to senior communities, we go to faith-based organizations and community events, and we help people connect to health risk assessments. We help them have the uncomfortable conversations. I mean, not that long ago, I think it was roughly maybe about a week or two ago, we were hosting one of these same exact events for our partners at the Pennsylvania Department of Health, and a lady's blood pressure was so high, we literally needed to call an ambulance and take her to the hospital. We had no idea how she was standing there. Her blood pressure was through the roof. And when we asked her if she had any idea, why her blood pressure was so high, she said, I'm diabetic, but I haven't had access to medication in over 9 months. So we were able to connect her directly with the provider, and our team was essentially able to connect her to the resources that she's been essentially looking for. Next slide. Some of the challenges that we face are having people that don't have access to a smart device at home, lack of technology skills, lack of commitment to engage, again, not having internet at home or no Wi-Fi, transportation, lack of motivation, as well as also the unavailability to attend and encounter student work. Next slide. So great to share the challenges, but what are the solutions? So our team members went above and beyond and created partnerships with the Pennsylvania Department of Health, as well as other corporate organizations in Pennsylvania. And we created solutions that can help to overcome those challenges. We were able to provide technology. And so we actually provided tablets to participants. We did a lot of follow-up. It's the nice way of calling it. I like to call it hand-holding. A lot of reminders that would go out to participants to join those classes so that we can have higher increased participation, as well as preparation. So before being sent to participants, all tablets got installed with Zoom and generic emails to easily find Zoom's join link and handouts. So really just holding that, going that extra mile and making sure that we're doing that hand-holding. Next, the willingness to teach. Our team is so patient and so loving when working with a community. So those who had no previous experience with tablets or video calls, we actually sat there for like a good 30 minutes to an hour and actually taught people how to log on and actually use these tablets. Participants also got to keep the tablets for their own health after completing the program completion. Special items were also raffled away to participants who engaged to the very end and completion for the program. And then what was most motivating for us, but also for them, was that group participants got to share stories of success. And for me, what I like the most is that people walk away with new friendships and new cohorts. Seeing the group of women and men that are now sharing recipes and helping each other to babysit while someone's going to get a job interview or picking up a few extra hours at work, for overtime, walking away and feeling like you have a sense of belonging and you're now a part of like a cult or a cohort, to say, right, of healthcare warriors that are essentially experiencing the same challenges that you're experiencing, but ultimately living healthy, more active, and engaged lives. Next 2 slides. So at the peak of the pandemic, Dr. Levine, one of our very own in our community, believed in our vision. Be careful what you wish for, George. It was just an idea when I ran it by her, and holy shit, did they believe in me. They provided funding to launch Pennsylvania's first ever COVID-19 mobile response unit. Next slide. So 2 large mobile units that have driven across Pennsylvania to 57 counties out of 67 across the Commonwealth, and have hosted a series of over 500 plus community-based events in partnership with great organizations like Bradbury-Sullivan as one of our very own partners in the Lehigh Valley region. Next slide. So what does CATE offer? CATE stands for Community Accessible Testing and Education. CATE provides COVID-19 testing in order to help with vulnerable communities, also shares resources and education on how to protect yourself and others from COVID-19, also provides vaccines, and also travels around the state and provide health screenings such as blood pressure and glucose checks. So really excited that we're pivoting and not just closing up CATE, but essentially community accessible testing and education that goes much, much further than just beyond COVID. Next slide. Here's a picture of what some of those events look like. For us, what I like the most is that these are clinics that are hosted at community events such as nonprofits, churches, or anywhere where we like them to happen. The mobile unit provides the opportunities for privacy and one-on-one conversations with providers for any uncertainty or worries. And what's really amazing about CATE is that it travels along with an amazing group of bilingual community health workers to do the type of work that we do. Next slide. So what's next? For us, we have a lot of great things coming up in the pipeline for this year, for 2023 and even 2024. Some people here on the call already know a little bit about some of these things, but here we are coming up on our 8th year of Latino Connection. We're really excited that we're finally launching the Latino Connection Foundation. So it's our 501c3 arm. Yay, finally, 8 years in the making. And it's launching this year, this spring, actually, in 2023. We have national partnerships now with CMS and really bringing to the forefront, the Medicare discussions that need to happen with people losing access to insurance and whatnot. As all of you know, Bradbury-Sullivan and Latino Connection have great partnerships with Penny, which is the health insurance exchange platform at the state level. So really bringing to the discussion that coverage to care. This year, we will be launching a new social responsibility campaign called Pleasure Responsibly. So really bringing to the forefront that shock imagery of men having sex with men, and how Latinos and African-American brothers and sisters are leading #1 in STDs. That is the one chart that we don't want to be #1 in. So we are bringing to the forefront those uncomfortable conversations and bringing that discussion with that shock imagery that can essentially help to create that behavior change in the communities that we essentially are looking to serve. having the discussion around digital equity and inclusion, that's so important that we keep that to the forefront. I mean, talk about even how healthcare is changing. A few days ago when Kelly and I were at the Latino Health Summit, this one lady talked about how her son had a follow-up appointment. And the appointment was a telehealth appointment. The call was, I think she said, roughly about 5 minutes, and she got a bill in the mail for $278. So, talking about digital equity, and even our seniors, that when they go to the doctor's office, they're just handed an iPad and said, here, fill this in, fill this out. So talking about that digital equity and inclusion. Research and evaluation for us, that's coming up around the community clinical linkage and programs, and really making sure that those links are happening in research and evaluation for community clinical opportunities. The evaluation of LGBTQIA outreach strategies, and any new partnerships and ideas that anyone from this call really wants to bring forth. Our team here is really open to creating innovative and engaging opportunities and ideas that can essentially help our communities progress and having those uncomfortable conversations. So thank you so much, Christina. Thank you so much to the Bradbury-Sullivan team for inviting me to be your keynote speaker at today's session. I'm just humbled to have joined each and every single one of you. Here's my email address. I love keeping in touch. So if I can be of any resource or any assistance to you, or any thoughts or ideas, anything that our team can help to contribute to your success, please feel free to reach out.
I was on mute. Thank you so much, George. I am now going to switch us over to some data, which I think people were very eager to see, as Kelly kicked us off with some of these data points from the Pennsylvania LGBTQ Health Needs Assessment. Let me just queue up my slides, and then I will take it away. And then following that, we will move into our Q&A. George, I'm so grateful for many of the points that you brought up, because they really align with the findings from the health needs assessment and from much of what we try to share following each new year of data. Some background for those who are not familiar with the survey. The Pennsylvania LGBTQ Health Needs Assessment was first piloted in 2015-2016 with the first statewide survey in 2018. And we've collected data on even years ever since. So there's statewide data from 2018, 2020, and 2022. The assessment collects data on LGBTQ Pennsylvanians' experiences with so many things, including their experiences with their healthcare providers, mental health and mental health care access, substance use, as George spoke about, the really high rates of tobacco use in the LGBTQ community, cancer and cancer screenings, sexual health, financial security, and more. And then when we have the findings from the survey, they're made available to a wide range of folks, including researchers, healthcare providers, government agencies, and really key, back into the hands of the community that helps collect the data. A little bit about the methodology. So last year we collected data between January and March, with 4,228 Pennsylvanians being included in the final data set. Some of the things that we wanted to highlight about last year's data collection was we had improved coordination of promotional materials, including additional materials available in Spanish. That data collection partners and that data collection coalition is a team of more than 40 LGBTQ community-based organizations and healthcare providers around the state. They received weekly updates from me with tips, updates on how data collection was going in their local region, and more information to direct promotion. We had targeted promotion specifically for our youngest community members. The youngest you can be to take the survey is 13. So really trying to reach those 13 to 18 and 13 to 24, as well as older adults, our Black, Indigenous, and community members of color, Asian American and Pacific Islander and Spanish-speaking community members. And as I said, we had improved outreach with just more materials, as well as dedicated partners that distributed materials in Spanish. And we'll actually be joined by one of those partners for our Q&A. We also added new demographic options, including the ability to identify as Middle Eastern North African to the survey, and new topics. So in 2020, the survey really took place during that initial lockdown, meaning we didn't have the opportunity to ask about experiences with COVID because the situation was evolving so rapidly. However, for 2020, we were able to add questions about COVID-19 vaccination. We also added neurodivergence, disability, and sleep as new topics for last year's survey. And let's dive right in. I know that there's a lot of information on this slide, but I wanted to share a little bit about the responses from different folks when we asked about what would you rank as the top 3 health priorities for the LGBTQ community. So starting from left to right, among all respondents, the most popular options were depression, isolation and loneliness, and suicide. And so you can kind of see, what did that look like among other groups? So for example, that was a high priority also for our older adults. However, isolation and loneliness was less a priority for some other groups. These slides will also be available following the presentation series. We're going to have all the slides and all the recordings available on the event webpage so that people can really dive in and explore different parts of the event series. We found that our young folks were particularly concerned with suicide, whereas isolation and loneliness was a particularly high concern for our community elders. HIV was a top 3 concern for our Asian community members, whereas violence was a high priority for Black and African American community members, as well as those under age 25. Access to care was a high priority for our transgender and non-binary community members, as well as those who identified themselves as being Hispanic or Latino. And alcohol and other drug usage was a high priority for older adults and Black and African American community members. So this is just a little bit of insight into how some different communities within the larger LGBTQ Pennsylvania communities ranked as what they want to see as healthcare priorities. One of the questions that we ask about healthcare experiences is, have you disclosed your LGBTQ identity to any of your healthcare providers? And this really ranges a spectrum of having not disclosed to most people have disclosed. So about 1 in 4 of our total respondent pool had not disclosed their identity to any of their healthcare providers. In many cases, because they're not comfortable doing so. I think a good follow-up to that is what kind of experiences, especially those negative experiences that we want to prevent, that LGBTQ Pennsylvanians so often experience. About 1 in 3 had experienced a negative reaction from a healthcare provider when sharing LGBTQ identity. That rises to about half for our Asian community members. And is also very high among Hispanic and transgender non-binary community members. Frankly, almost any of these percentages is too high. It's so hard for people to be able to seek healthcare when they're in fear of what reactions they might have from their providers. We also asked, have you had a negative reaction from a healthcare provider based on your race? This was lowest for our older community members and highest among Black and Asian community members. And as I mentioned, that fear often prevents people from seeking care. About 45 to 46% of our total respondent pool often or always fears seeking care because of either past or potential negative reactions. Again, lowest among our older community members, but extremely high among transgender, non-binary, and Hispanic community members, with for most of the subpopulations I picked just for this presentation, it being about half. Unfortunately, many LGBTQ Pennsylvanians lack confidence that their provider is culturally competent with respect to LGBTQ healthcare. This was highest among transgender non-binary folks, as well as our young community members. LGBTQ Pennsylvanians also lack confidence that their providers have medical expertise related to their health needs. I wanted to give us plenty of time to look at some of the qualitative feedback that respondents provide. Among all the responses that we receive, some of the most common suggestions are about how to create a welcoming and affirming environment through the use of language, for example, having pronoun options on your intake forms, or the language you use in the materials you use to promote your services, as well as having visual cues, things like safe space indicators in your waiting room, materials that feature a diverse range of folks. George mentioned it's hard to feel safe somewhere if what you see doesn't look like you. Avoiding gendered language, asking and then respecting the pronouns your patients and clients share. The overwhelming need for providers to be trans knowledgeable, as well as better education on PrEP and HIV. Some of the responses shared, I've noted here. Respondents under 25 years of age shared, don't make assumptions. Trans and non-binary community members shared that all staff, including front office staff, need to be trans competent and affirming. A selection just from the general population noted something that we've heard throughout this series, that you need to engage community leaders and community-based organizations. One of our respondents of color shared, it's important that you become comfortable interacting and treating queer patients. When you are uncomfortable around us, we can tell. And it makes it hard for us to be honest with you about the treatment we need. An Asian identified community member shared, ask about sexual orientation. If you don't ask, I won't tell you, because I assume you are either uninterested or uncomfortable or unwilling to discuss queer sexuality. I have rarely told my providers I am queer because of this. A community elder shared that providers need to be more aware of issues for the aging LGBTQ population. We're not all 25 years old. And a Hispanic community member shared, listen when we talk about how we feel and offer responses that help us care for and heal ourselves. Some additional things shared were about interacting with patients, including smile, engage, and listen. That providers need better awareness of prevention medication for HIV. That I don't just need my provider to be LGBTQ friendly. I need you to be trans knowledgeable. This respondent shared that they felt like none of their doctors know how to help them when their body doesn't act as expected in relation to physical transition. That providers need to understand that many people have fears around healthcare, as responses to our other data shows. I've never had a healthcare provider acknowledge how scary it can be accessing health as a trans person. I would love a doctor to ask, what can I do to make you feel safe and affirmed as my patient? That all patients should be treated the same. That you need to be mindful how comfortable we are sharing information if parents are in the room, something that can be really key when treating transgender and LGBTQ youth. And that to be respectful and caring towards LGBTQIA+ youth, as they can be anxious in disclosing identity. I encourage anyone who has not yet read the full report to access it online, and I will share the QR code so you can do so. But I wanted to talk briefly about some of the recommendations that we've made in this report and ones that I think particularly apply to what we've talked about today. The first one being identify community-wide mental health supports and recognizing that mental health support may look different for different intersections of the community. What is culturally appropriate for one community may not be the same elsewhere. And that engaging with community organizations may be the best way to learn that information. to encourage health screening discussions and health education. I think that's especially possible with some of the resources available here in the state, like the CAPE mobile units. Bolstering community support for Black, Indigenous, and people of color. And really understanding that those folks may experience health at an intersection different than the rest of the population of Pennsylvania. And again, partnering with LGBTQ community-based organizations and really taking a look at the population you serve and saying, whether it's LGBTQ or another intersection, is there a community-based organization that is already affirming to this population? It is so much easier to seek care and seek services in an environment where you're comfortable. And please refer to pages 53 through 55 of the full report to read more about these recommendations. I'd like to thank Research and Evaluation Group at PHMC, as well as the Pennsylvania Department of Health for their work on the assessment. And please grab this QR code and download that full report. It's really interesting and there's so much to dive into. The survey really provides us a wealth of information about LGBTQ health here in Pennsylvania. As George said, you can't know what people need if you aren't asking. And I am going to stop sharing so we can start our Q&A. It looks like we may have lost George, but we can kick off anyway. And I would like to introduce Jorian Rivera-Veintidos. They are the Prevention and Education Manager at galaei. When I mentioned earlier that we had dedicated partners that really helped distribute this survey, galaei was one of them, and the work they did was invaluable. A little bit about galaei, if you're not familiar. galaei is located in Philadelphia and is a queer, trans, Black, Indigenous, and people of color radical social justice organization. They are committed to serving the Latinx community, as well as widening their embrace for other members of the LGBTQ community. galaei provides and facilitates queer educational services, community wellness, and is committed to healing historical harm. galaei is dedicated to creating access, opportunities, sexual empowerment, and economic development for all queer, trans, and BIPOC individuals while fighting systematic oppression, structural racism, discrimination, and white supremacy. And I think we perhaps have a few questions the Q&A. Jordan, if you'd like to kick us off.
Yeah, hello everyone. Just really thank you, Christina, for introducing me. My name is Jorian Rivera-Veintidos. I go by they, them pronouns, and I am the Prevention Education Manager with galaei. A little bit about me, I've been with galaei for almost 10 years now. I started off as a volunteer with galaei, and then I worked my way all the way up to management to almost secondary in command. And just to let you know, just some upcoming events that we do have with galaei. We have the Black and Brown Excellent event that's happening at William Way in the neighborhood. It's an all-day event that's going to cater to workshops to learning how to be a drag queen, learning how to vogue, and having a transparent conversation where we're going to have Mother Sister talk about the idea of how to navigate queer and trans youth and how to support them and be a parent with them or a guardian. We have all-day vendoring and tabling with CBOs and Black and Brown artists. We have a panel discussion that revolves around the pursuit of ourselves and what is the work that we do and how does it involve in our personal and our professional lives. And then we have a variety show where we're going to highlight all Black and Brown trans performers and non-binary drag kings and queens, burlesque show dancers, you name it, we have it for an all-day event. galaei is also providing prom this year, alternative prom at the Philadelphia Art Museum. We are throwing our 34th annual youth alternative prom, but this year will be our first annual adult prom. It's very Met Gala theme, very up to the nines, dressed to the nines, dressed like you're going to the Met Gala, and it's going to be at the Art Museum on June, the second weekend of June. I think it's the 10th or the 11th. And then lastly, galaei is also putting on, for the second year in a row, we are putting on Pride, galaei Pride in Philadelphia. So that will be happening on June 4th. We're going to have a Latin section, we have a sober section, we have a relaxation section, a wellness section, a key alley, a drag alley, you name it, we have everything in it. For pride, we believe in reclaiming pride for ourselves. We believe in reclaiming what is ours and how pride used to be back in the day. And I'm sorry to say, not full of white people and cops and paying people to come to pride. We want to rename it as free. Pride is free for everybody. Our resources is for our Black and brown folks, but it was originally made for back in the 1980s. So I'm just here to offer to support you and moderate you with some questions. And if, let's see, we're going to go to the Q&A and check out some questions. So the only person I have right now is by John Butts. Will today's presentations be made available to attendees?
So for anyone who has to jump off or wants to share this information with those who were not able to attend today, all the presentations in this series are being recorded. And following all 4 presentations, we're going to put together the slide sharing data from the health needs assessment, and the recordings in that slide deck will be available on Bradbury-Sullivan's website at the same place where you originally found the registration links. And we'll do an email blast in June following the final event to be able to share those, because we've gotten a lot of interest from folks who just weren't able to make the time slot that we chose. So I really appreciate everyone's interest in what our keynote speakers have had to say, in hearing from our community partners who've moderated the Q&A, and in diving into the data. It appears that George may have either had to hop off or had connectivity issues, so I will do my best to answer any other questions. I think we maybe had 1 or 2 questions that were submitted ahead of time. But also, Jorian, if there's things that you want to share from your expertise working in the community, happy to hear them.
Yeah, I was like, there was a lot of things y'all have both, you and Christina, yourself and George have mentioned that, like, and that does get integrated within like Galei's work a lot of the times. So my question is to y'all and like anybody else listening, you know, when doing the work and doing the formulas and the formation, you know, we think of the macro and not so much sometimes the micro. So in doing, and when we do realize the macro, what is your game plan or what is your goal plan when burnout starts to happen? You know what I mean? You know, we're infrastructuring, building foundations, building, you know, these programs that are essentially going to be for the community, but we sometimes forget we are also the community. So what does the burnout process or like the self-care process look like in building these programs or these networks for these community, for us specifically?
I think that's such a great question. And I think something that George said during the keynote, really, how do you keep people engaged, especially when so much of the work that is involved at both Latino Connection, at galaei, at Bradbury-Sullivan, and for many other organizations is by and for the community. George talked about how do you retain bilingual community health workers, because they're such a valuable resource. And he shared something that seems so obvious, that you need to compensate them fairly, and that giving them training and resources means that they're going to stay and be engaged over time. It's something I've been hearing a lot from the community-based organizations work on the health assessment, is that, you know, that data collection coalition receives some funding to do that work. Some of it goes towards, you know, social media, but a lot of it just goes right to the everyday things that they need, supporting their staff. And that's something I hope to see grow over time, is that this is a mechanism that we can be supporting other community-based organizations around the state. But absolutely being able to provide your teams training for those who are attending today and planning on completing CEUs for nursing and social work. I think, you know, whether if you're someone who is a manager in an organization and that's something that your staff needs, that they need CEUs to be up to date on their qualifications, sharing those opportunities and lowering the burden to access. Is there anything that at your organization right now, Jorian, that you would want to share? The solutions that you found?
Yeah, so galaei focus on QT BIPOC. So a lot of our work focuses on food distribution, condom, and like well, not prevention services. So we focus on like pregnancy tests, COVID distribution, condoms, or quick, and like everything you said, like we kind of do on the back end. So we even work with like having a community fridge outside our organization 24/7. Like you put out like a first in, first out kind of deal. A lot of our work focuses on finding what, like y'all said, what the community actually likes and wants to do. And because we focus on trans identity, youth, and community wellness as a whole, we try to implement the ideas of what is youth watching today, looking at today, what is adult watching today, looking at today, what are their interests, what is TikTok giving, what is Instagram giving? And it's really just navigating those intersections with our programming intersections. You know what I mean? Like we've grown out of the pizza party, we've grown out of that, you know what I mean? So it's just finding innovative ways that's gonna be able to help us as well. Question for Glenn, what is an adult prom and can I bring my wife? Adult prom is going to be June 10th or 11th. I'm going to find more details I'll send to everybody. And yes, you can bring your wife. The more the merrier. We have to fill pretty much the whole entire art museum on 2 floors. Yeah, so yes, bring your wife, bring your friends, bring your family, dress very Met Gala style. The more the merrier. Love it. But I do have a question from the community. What is it good for health providers and community organizations that are trying to be more culturally responsive and more culturally appropriate and relevant for the community that they serve?
I'd love for if folks have responses to that in the chat, please share them. You know, what do you think are first steps that whether it's healthcare providers or community-based organizations can be taking? I know here at Bradbury-Sullivan in Allentown, one of the things we had to do was sit down with folks and ask. I really appreciate that galaei shares their philosophy about healing historical harm, because that is often a barrier that you have to overcome. How can we provide services? How can we provide education when there's mistrust? So establishing trust and asking questions, I think for us is often a first step. That was how we handled working with giving education and resources during COVID, was asking, what are you worried about receiving the vaccine? What would stop you from getting it? And then making sure that trusted voices and we were sharing accurate and timely information. So if anyone has feedback on that, I'd love to hear it in the chat. Please just, drop your thoughts. And while people are doing that, I'm going to answer this next question about differences between the 2020 LGBTQ health needs assessment and 2022. I was really lucky to join this team during the dissemination of the 2020 data. So in the time between collecting the new data, and then I got to know that data set very well. And some of the differences that I've noticed is one, which is something I find encouraging, is that the number of folks who are uninsured or unsure of their insurance status at the time of taking the survey has gone down just a bit. I believe it went from about 6% to closer to 4%. And that was something I was very much excited to see. Not having insurance can be a pretty direct barrier to healthcare access. One of the other things that we saw that I think is encouraging is we ask about whether you've received certain preventive healthcare screenings, things like mammograms, both cervical and anal PAPs. And it looks like as community-based organizations, as well as healthcare organizations throughout the state are making sure that they're sharing affirming and accurate information about those screenings, that more folks in the LGBTQ community are accessing those screenings. That also includes HPV vaccination. We do work around sharing providers in our area that provide like affirming mammograms and education. So I'm always excited to see that when it looks like that work is making an impact. Any other questions from folks?
So question from the audience is, where can attendees get more resources on how to provide culturally appropriate and culturally responsive education programming? On how to provide, where can they get more resources?
I think seeking out the community-based organizations in your area. So whether if you're in Philadelphia, look up galaei and other LGBTQ or BIPOC serving organizations. Also, if there's national leaders in this area, I think of organizations like Centerlink or the LGBTQ Cancer Network. Bradbury-Sullivan does have an education institute where we provide trainings. There is likely resources within your community. Jorian, if you have anything additional to add.
Yeah, so galaei offers tons of resources. We have anything from housing to food disparities to pretty much anything and everything, to job applications, to jobbing, to gender market changes, to new clothes, to pretty much any type of resource you're looking for. If we don't have it, we have outside resources. If you're looking for linkage to care for HIV, PrEP, PEP, STI screenings, pretty much anything we have type of resources we will have. I do have a question in the chat from Amy. Do we have any specific messaging for the queer community on tobacco cessation, more than just putting things in rainbow hair quotes?
I really like that, Amy. Thank you for that question. I was appreciative that George was able to share some materials that have been available both in Pennsylvania and on a national level. For the first thing that comes to mind is the This Free Life campaign, which George had shared some of those graphics. I really love that campaign. I think it's a really good one. Bradbury-Sullivan puts out a variety of materials. There are a few things available from the Department of Health, including rainbow quit lying cards. As George mentioned, many folks just aren't aware of or are not sure about accessing the quit line, even though it's a free cessation service. So making sure that when we hand out those materials, that people understand that it is for them. It's not just for everybody else. That's a great one. I'm excited to see the many Pride celebrations around Pennsylvania, including Philly Pride, that have either gone entirely tobacco-free or that have dedicated clean air spaces that will be sharing materials and messaging. Something that we've been thinking about as an organization here at Bradbury-Sullivan is how do we share not just affirming tobacco cessation materials, but really helping understand folks the history of that predatory marketing that George shared. I am so appreciative to hear people talking openly about some of that history, including things like Project Scum. Getting it out in the open is really important, and then taking back pride from the tobacco industry, just piece by piece. And I really see that as a success here in Pennsylvania. And I think you can probably let folks go just a few minutes early, get 15 minutes back in your day. But so appreciative to have everyone join us. Again, I'm going to thank Kelly, the Department of Health, George, Color and Culture and Latino Connection, Jorian and galaei. Please join us. And I'm going to share my screen. No, I'm not, because I can't find the button and I apologize, but please check out the event page that and I can share that again. Register for the May and June events. We're going to be talking more about tobacco cessation and clean air, especially at Prides in June. So please join us in Philadelphia, either in person or via the registration link. And again, all these events are going to be recorded and available following the event series. Thank you everyone for joining us.